Hello ACVN, this is Sarah Jackson, video number 8, Barrier Nursing, treating parvovirus suspect patient Charlie Wilson. Selecting PPE, I have my gown, which I'm doing at the top, tying in the middle, putting on. You don't necessarily need a mask, but for coronavirus we should be wearing masks inside at this present stage. And two pairs of sterile gloves, which go over the top down. Ends. So just to show you the demarcation of the wards and how I know that it's the isolation ward. The isolation ward is labelled here, as you can see. It says authorised staff only. In the description on the hospital it says level 4 barrier PPE. You can tell also by the fact that we've got a foot bath. You can tell that it's away from the hospital, away from the consult rooms, and away from the kennel room. The foot bath over here, and I'm making up Trigine 2 to the dilution rate of 1 to 20, which is the rapid high risk rate suitable for isolation, and I'm making up to 1,000 millilitres, so I divided that by 20, which gives me the 50 mils of the Trigine, and the remainder is the water, which is 950 mils, which I measured out before. It goes into the water tray. Then we have the 50 mils Trigine 2, which I've made up in a syringe to be precise. Do the mix and put that down in front of the isolation ward. The ISO ward I'm entering correctly via the foot bath. I then dry my feet when I go through the disinfectant. Presume it's actually 5 minutes of contact time, not me walking through as quickly as I am for this video. I'm going through quickly in order to not let pathogens in from the ISO ward into the hospital and from the hospital into the ISO ward. So as I go, cover the 15 centimetre tray. That would be 5 minutes in there. Dry my feet in, close the door quickly, finish. Number 8, I'm moving Charlie safely from his cage and placing him onto the table using minimal handling technique. Using also a slip lead. Hey Charlie. Good boy. And obviously he will be walking independently out. Then I will be picking up using very minimally away from my body, but safely, underneath his belly and bum. Putting him onto the table, which you can just about see. Charlie Wilson's on the table. I've got a slip lead in case he decides to jump off. I'm being very minimal in my TPR. I'm holding him, but I'm not actually restraining him too heavily. I'm not crouching over him. I'm not making too much contact with myself, which I'm a fomite. So looking at his mucous membranes, blanching those. That's under 2 seconds, pink and moist. Make sure those are actually in my ears. So, listen for our heart rate. Presume that is 15 seconds that I'm listening to the heart rate. If I calculate that's 30, which is 120. That's within normal range. Get my hands on. Let's do his temperature. Again, I can hold him very lightly, but not too much contact. I'm trying to do this quickly as well, so we want minimum exposure while he's out. So just switch that on, put that in. And then, okay, that's 38. Then with Charlie, I'm going to grab him gently, holding him away from myself, putting him on the floor, and taking him into the cage over there. I don't know if you can see. Okay, Charlie walks along. Once the second is in, I remove his slip lead over his head and quickly close the door. Charlie's TPR, now cleaning the items. So what we do before we even start the clean is obviously we've had major contact with him on our hands. So I'm going to pull off my gloves using the inside pulling up like that, sliding my finger underneath and over like that, not making contact with the outer layer. I'm going to be using Trigene 2. This is the isotrigine mixed at the dilution of 1 to 20, which is a high rapid risk rate. Also some paper towel. I'm going to be squirting the items that I just used for TPR, the stethoscope. That's going to have a contact time of 5 minutes. Then obviously 5 minutes passed, and I am cleaning the items with paper towel, making sure all surfaces covered over sleep cleaner very thoroughly, and dispose of that into the isomer bin. Then I get rid of all waste that's surrounding. Let's get rid of the cotton swabs, clinical waste, infectious waste, and general waste. All go into the ISO ward bin, which then goes into the outside bin, which is the ISO tall bin, which is collected by a specialist. Just to show you, I'm taking off my PPE. So I start with gloves, and I touch just the inside and pull away. I will wash my hands after this thoroughly, using the inside, putting them into the ISO bin, undoing the straps, pulling this forward, so in on itself, put that into the bin, my hat, and lastly my mask as per the AVA guidelines. I'm going to take you with me to the footpath. So close the door again really fast, not letting out any pathogens. Then I'm walking through the footpath. That's a contact time of 5 minutes for the Trigene 2, and then dry my feet. I'm just going to wash my hands, come straight out of the ISO ward, straight over to the sink, wet my hands. Doing this very quickly, obviously I would spend about a minute doing this usually. So up to an angle, round, scrub those nails, do those thumbs, get it in like that. Rinse off. Then I use a paper towel out of the dispenser to dry my hands thoroughly, and into the bin. Video 8, Sarah Jackson's PPE discussion points. We wear the PPE in order to protect ourselves from the zoonotic patients, ISO patients, pathogens, and also to protect the patients from receiving pathogens from the other patients in the hospital. Demarcation in the isolation is important to keep the infection controlled in space and treated in one space in one area, and then that area does not then cross-contaminate with the other areas. Also, it alerts staff to wear high-level PPE. Their behaviour must change within that space, and also stops work experience / untrained people to go in the space. Additional precautions in the ISO ward include having dedicated equipment within the ISO ward which is labelled and does not leave the ward and cross-contaminate with other equipment. We have minimal handling technique, minimal time spent in the cage or ward, and we also have high dilution rates for cleaning the ward, the foot bath, as well as stringent hand care routine, hand washing. In terms of leaving the ISO ward, we close the door promptly, stand in the foot bath for 5 minutes, dry our feet, don't touch anybody, anything. Then we go straight to the basin, wash our hands as per the AVA guidelines. In terms of removing our PPE promptly, we use probably the most infected item first, which is our gloves. then we remove our protective eyewear, then we remove our gown inside out, then it's our shoe covers, and then it's our mask lastly. PPE is disposed of into the ISO ward bin first of all. Secondly, it is then removed and taken into the ISO bin outside of the ward, which is picked up by specialist handlers, waste handlers.